Assalamu alaikum dear students. Today's topic is respiration and the subtopic is artificial mouth-to-mouth respiration or resuscitation. Until an advanced airway is available, use mouth-to-mouth respiration. For example, if a pocket mask or a bag mask is not available at the scene of an accident, mouth-to-mouth rescue breathing is effective in delivering oxygen into the lungs of the patient. For this purpose, you need to follow the following steps. Open the airway by performing head tilt, chin lift maneuver. Pinch the nose shut to prevent air from escaping when delivering breaths. Create a seal with your lips around the individual's mouth. Blow into the individual's mouth and watch the chest. If the chest does rise, you may need to unblock the airway. Give an individual breath. Make sure the breaths are duration of a full second. If the chest doesn't rise, in 2 breaths, continue giving chest compressions. If the patient is revived, keep him warm and do not move him until the doctor arrives or at least for 1/2 hour. Transport of oxygen in the blood. In human beings, respiratory pigment is hemoglobin. Hemoglobin combines with oxygen to form bright red oxyhemoglobin. In the condition of low oxygen and less pressure, oxyhemoglobin is unstable and splits into normal purple red colored hemoglobin and oxygen. Carbonic acid, an anhydrase enzyme present in the RBCs, facilitates this activity. Only a small portion of oxygen also gets dissolved in blood plasma, about 1.5%. Ability of the hemoglobin to bind with oxygen is the oxygen carrying capacity. Oxygen carrying capacity of blood is directly proportional to the partial pressure of oxygen. Maximum carrying capacity of arterial blood 20 ml per 100 ml of blood. It means it is 100% saturated. Achieved at oxygen pressure of 100 mm mercury. Normally, each 100 ml of arterial blood contain 19.4 ml oxygen, out of which 90% is saturated, while each 100 ml of venous blood contain 14.4 ml oxygen, out of which 75% is saturated, and its partial pressure is 40 mm mercury. This 5 ml of oxygen is released to tissues by each 100 ml blood. Transport of carbon dioxide in blood. Carbon dioxide is more soluble and dissolves freely in the tissue fluid surrounding the cells. Carbon dioxide is transported in blood in 3 different states. as bicarbonate ions, as carboxyhemoglobin, as dissolved carbon dioxide in plasma. In this slide, when carbon dioxide moves freely in the blood in the form of bicarbonate ions, you can see the reaction. Carbon dioxide combines with water to form carbonic acid in the presence of enzyme carbonic anhydrase in blood. Carbonic acid is unstable compound and dissociate to form hydrogen ions and bicarbonate ions. The accumulation of hydrogen ions increases acidity in the blood. That is, it leads to the decrease in pH. This does not occur since hemoglobin buffers the hydrogen formed. The hydrogen ion readily associates with oxyhemoglobin to form hemoglobinic acid, and oxygen is released to the tissues. Negatively charged bicarbonate ions diffuse to the plasma. This is balanced by the diffusion of chloride ions in the opposite directions. And this whole process is achieved by special bicarbonate chloride carrier proteins that exist in RBC membrane. This protein moves the two ions in opposite directions, maintaining the balance of the ions on either side. This is called the chloride shift or Hamburger phenomenon. As carboxyhemoglobin, about 23% of the carbon dioxide is carried as carboxyhemoglobin. Carbon dioxide binds with hemoglobin to form carboxyhemoglobin. Carbon dioxide basically combines with the globin part of hemoglobin. Each globin part consists of 4 polypeptide chains, and the reaction depends upon the partial pressure of carbon dioxide. When the partial pressure of carbon dioxide is higher in tissues than in blood, carboxyhemoglobin occurs. When partial pressure of carbon dioxide is higher in blood than in the tissues, as in the case of lungs, carboxyhemoglobin releases its carbon dioxide and sets it free as dissolved carbon dioxide in plasma. Now in this case, the fluid portion of the blood in which blood cells are suspended, only 1% is carried in this way. This is an inefficient way of carrying carbon dioxide. Thank you. This is all for today.